Good morning, everyone. We've got 19 new cases overnight, 13 linked to current exposure sites or identified close contacts, with 6 still under investigation. Pleasingly, 11 of today's cases have been in quarantine in their entire infectious period. 6 spent part of their infectious period in the community, and there are 2 that are still under further investigation. In further good news, the number of people in hospital has dropped. We now have 8 hospitalised, with 1 remaining in intensive care requiring ventilation. Testing numbers increased significantly yesterday to nearly 3,500. This is a big increase that we're really pleased to see, and we thank everyone for coming forward to get tested. So a reminder that you do need to come forward for testing if you have any symptoms or you have been in any of the exposure sites at the times that are listed on the website. We update our exposure sites at least twice a day, and we do ask people who've been in those locations at those times to come forward for testing. This helps us have a really good understanding of where the virus is in our community. On the vaccination front, yesterday we set a new record for the number of vaccinations within an ACT government, within our 2 clinics, more than 3,000 doses administered. It's a record day of vaccination for ACT government clinics. We are now at 71.4% of the 344,000 ACT residents aged 16 plus with their first dose. So that's about 246,000 of the 344,000 who are 16 plus who've had that first dose. We have 47.6% with a second dose, and that is around 164,000 Canberrans aged 16 years or older. Our city has a population of 431,000. That means today there are still 185,000 Canberrans without any vaccination at all, and 267,000 who are not fully vaccinated. This means we are still several months away from 80% of our 12 plus population being fully vaccinated. And so the vaccination program remains our #1 priority in the coming months. Shortly, Dr. Coleman will provide an update on today's cases and the epidemiology of our outbreak. And today we are also joined by the Acting Clinical Director of Obstetrics and Gynaecology, Dr. Natalie DeCure, who will talk about vaccinations during pregnancy. So for those who've joined late, a quick recap: 19 new cases, 13 linked, 11 in quarantine during their entire infectious period, 6 known to be infectious in the community for at least part of that infectious period, 8 in hospital, and 1 on ventilation in intensive care, in the very capable hands of the fantastic staff of the intensive care unit of Canberra Hospital. This patient has been in intensive care for some time, and our thoughts and love remain with that individual's family. I'll now invite Dr. Coleman to provide the update on cases of epidemiology, and after that we will be hearing from Dr. DeCure, and then we'll be available for questions. Thank you.
Thank you very much, Chief, and good morning everyone again. As you may know, I'm Dr. Karen Coleman, the ACT Chief Health Officer. So since our last update yesterday, I can confirm we've recorded 19 new COVID-19 cases. This brings our total cases for this outbreak to over 400 to 404 cases. A total of 174 have now recovered, which is great news. 11 more overnight. So this leaves us with 230 active cases in total at this point in time that we're managing. So of the new cases today, out of the 19, 13 can be linked to either known cases or ongoing clusters, with 6 remaining under early investigation as we continue to work through that today. Out of those 13 that are linked, 11 are household contacts, so continuing to be a large, important, ongoing transmission. Out of the total of 19, 11, which is great news, were in quarantine during the whole infectious period. And of the remaining 8, 2 remain under early investigation, while 6 spent some time in the community during their infectious period. As the Chief has highlighted, we have 8 people in our hospitals, with 1 of these in ICU and requiring ventilation. And as we've previously reported, the vaccination status of our cases remains very similar. 6 are unvaccinated and 2 have received 1 dose of the vaccine. And over the course of this outbreak, 23 people have been hospitalised in total for COVID-19. Of these 23, 3 people have required treatment in ICU, with 2 of them needing ventilation. We now have just over 1,400 self-identified close contacts and over 330 active exposure locations. In terms of the broader outbreak, there continues to be very little change in the age range breakdown, with the vast majority of cases continuing to be seen in our young adult population. We remain at 14 public sites of transmission. There's been 3 changes overnight. 1 new case has been linked to the Murchie Indian restaurant, bringing that total up to 8 cases. There are 2 new cases and 2 previously confirmed cases now linked to the Busy Bees Childcare Centre, which now has 6 cases in that cluster, and another 2 cases linked to the Priceline Pharmacy in Woden, bringing that up to 5 cases. And it's wonderful to see our testing numbers going up. So thanks very much to everyone for getting out there and being tested appropriately. I do want to just let everyone know that we have some changes to our testing clinics around Canberra from tomorrow, and I really encourage you to get on the website and look at your social media to see exactly what they are. But in summary, Brindabella and Western Creek walk-in centres will close for testing after today, although they will continue to be available in the future if we need to stand them up for surge testing. And from tomorrow, the COVID-19 Surge Centre at Garran will come back online as a testing clinic. That's worked very well as a testing clinic before, so we're bringing that on board with vaccination moving out to the AIS. And my shout out today is to our amazing social and web team. This team does actually literally work day and night to provide the information to you and answer your questions and queries, because I know that many of you are on social media late into the night. I can say that they do have the best snack stash in the building, although the mix of green, amber and red foods is probably not what I would like to see. Maybe some more green foods than red foods, but we'll continue to work on that. The small team has received over 200,000 comments and direct messages since the lockdown commenced, and the website over 20 million page views. So that's an awesome job for such a small team. Thank you very much. I'll now hand over to Dr. Natalie DeCure.
Thank you, Dr. Coleman, and thanks everyone for having me here today. My name is Dr. Natalie DeCure. I'm the Acting Clinical Director in the Department of Obstetrics at the Canberra Hospital. We know that women in pregnancy who have COVID are more likely to suffer severe illness. They're more likely to be hospitalised and also more likely to need intensive care treatment. Along with unwell mothers comes unwell babies, and there is an increased risk of preterm birth. In the general community, the consensus is still that basic measures can reduce our risk of COVID. They include the public health orders, social distancing, wearing masks, but that also includes vaccination. The Royal Australian and New Zealand College of Obstetricians and Gynecologists, as well as the Australian College of Midwives, are both very strong advocates for vaccination in pregnant women at any stage of pregnancy. This confidence they have is drawn from global data. There are tens of thousands of women, possibly more, coming from the UK and the US who all received Pfizer at all stages of pregnancy, whether it's first trimester or right at the end. This data did not show any increased rates of adverse outcomes for either mum or baby. Very similar to other vaccinations that we routinely give to pregnant women, including the flu shot or the whooping cough vaccine, the Pfizer vaccination is not a live vaccine. Therefore, there is no risk of transmission of infection to your baby. Pfizer works by triggering the mother's immune response to make natural antibodies to protect her from getting the infection in the first place, but if she does, a reduced severity of illness. The added advantage is that we know that this vaccine is degraded very quickly in the maternal system, soon after it's given, and equally does not cross the placenta. So babies are not exposed to Pfizer itself. What we also know is that the antibodies that mum makes do cross the placenta. So we've got that added potential that baby may be born with some protection. We are advocating for vaccination in all pregnant women in the ACT, and we are aiming for 2 doses before birth. For women out there who are in their first trimester, there is no increased risk with miscarriage or other complications, so we encourage you to access the bookings line as soon as possible. For the women out there who are nearing their time of birth, maybe you're due in the next couple of days or weeks, there is still time to get that 1 dose in, and we know that a single dose is still of benefit. I also wanted to make special note for the groups of women out there who have complex backgrounds. As an obstetrician, I provide care for women who have medical conditions in the background or other complexities that make decisions about medications or vaccination in pregnancy a difficult one for you as an individual. I really strongly encourage you that if you have any doubts about what is best for you and your baby in this scenario, to have a discussion with your care team. This could be your GP, it could be your midwife, or your obstetrician. We would be happy to see you, look at your specific circumstances, provide you an outline of the risks and benefits that apply to you specifically, and then help you to make the best decision for you and for your baby. And I'm happy to take questions.
Doctor, what's your advice for women who are hoping to become pregnant, not just those who are already pregnant?
I understand there is a lot of anxiety around any potential medication exposures or vaccinations for women who are trying to conceive. The advice coming out of the data I referred to earlier is that there is no risk for women trying to conceive or maybe in very early pregnancy now. There is also no evidence that suggests that the vaccination reduces fertility. So our advice at the moment for women who are currently trying to conceive is not to delay conception, so don't stop trying while you're waiting to be fully vaccinated, but conversely, don't wait to be pregnant before you're getting vaccinated.
But the advice would be to wait for Pfizer?
Most women will be eligible based on their age group. There is a group of women who might have access to AstraZeneca, for example, who are not yet pregnant. And at the moment, we're providing individualised advice for women who might receive a first dose of AstraZeneca, but then be pregnant by the time they're due for their second dose. Thank you.
Thank you very much, Dr. DeCure. Happy to take any questions. Who would like to step up first?
Actually, just wanted to ask you a little bit about, so the Prime Minister's being criticised today for leaving Canberra to go to Sydney for the weekend for Father's Day and then return. Can you confirm when that exemption was granted and if that exemption involved him being able to attend an event in person?
I'll need to get the exact. You want the time or the time of day or the date?
Oh, the date.
Okay, I understand it was the 6th of September, but I will get that absolutely confirmed for you. I don't know what hour of that day. And the exemption, which is consistent with the definitions of essential worker require attendance at a workplace and a place of residence only, and a range of other sort of regular testing requirements and the like. So it's not the first time that an exemption has been granted to a federal parliamentarian, but there are a set of strict conditions that are attached to exemptions.
Do you personally, though, think that it's fair that he's, able to leave Canberra to what it seems like go home just for Father's Day and then return when so many others aren't even able to, at the border, hold the hands of their relatives?
I can understand community frustration at what they would perceive the Prime Minister has done in relation to a trip home over the weekend. You are free to leave the ACT. Is then obviously free to apply for an exemption as an essential worker to come back in, and attendance at a National Security Cabinet meeting and the Women's Summit were the reasons that were submitted. That would qualify as essential work. Prime Minister's role is unique in the nation, that is understood, and Canberra faces a challenging set of circumstances as the seat of government in the national capital in terms of continuing the operation of our nation's parliament and democracy. And so this is a balance that we have to strike. It's not the first time the Prime Minister has sought an exemption. He has obviously undertaken extensive quarantining at the Lodge as well. The two venues that he's permitted to attend, his workplace, Parliament House, and the Lodge, are amongst the most remote from the rest of Canberra. They sit behind 2 metre high fences. No one else gets into either place without very strict security protocols. But look, I'm not the Prime Minister's keeper. I don't offer political advice to the Prime Minister very often, and he probably wouldn't listen to me anyway. I think these are questions that are probably best posed to him.
Is there a bit of a clash between your advice, ACT health advice, and his medical advice from the Chief Medical Officer?
Well, there is an intersection of obviously view and responsibilities around the Commonwealth Chief Medical Officer and Dr Coleman as the Chief Health Officer of the ACT, that the two do meet and talk and are part of AHPPC.
Perhaps maybe the Prime Minister needs to just be exempt from all exemptions then, if there seems to be.
Well, look, we need to maintain an essential worker arrangement and an exemptions arrangement that meets the functioning needs of our city. And then we also need to recognise the fact that Canberra is the seat of government and that the federal parliament does need to operate. But these ultimately are questions that are best asked and answered by the Prime Minister. We're not having this conversation because of any decision I have taken. It's a decision that the Prime Minister has taken. Is it a cause of concern for many in the community? Clearly it is. I mean, this is the biggest press conference we've had for a little while. There's a few faces in the room I don't normally see, who I presume are all here to ask me these questions as well. So we might go to the next one.
Mr. A couple. First of all, just how much detail did ACT Health seek in improving this exemption, given it is actually possible to dial in on a secure line to the National Security Committee of Cabinet? And secondly, there are millions of Australians who haven't seen relatives for months or even more than a year. Can you understand that they would see this as something of a double standard, and what's your message to them?
I understand that people are very concerned about this, but that's a matter for the Prime Minister to address. It's his actions that have led to this. In terms of the information required for an exemption for federal parliamentarians, they need to fill out the form like everyone else. And I think it is reasonable as a reason to return to work for the Prime Minister of Australia to undertake national security meetings of Cabinet. Now, I'm not in the National Security Committee of Federal Cabinet. I don't know about the arrangements associated with secure lines and the like. So look, that's a matter that we need to take on trust from the Commonwealth. I think that's an appropriate thing for us to do.
You've already said you can understand the perception of unfairness. Does this whole situation put you and your government in an awkward position? How do you feel about having to deal with it?
Well, clearly, I would prefer not to have this press conference dominated by questions about the Prime Minister when my responsibilities are to 431,000 Canberrans who are managing through a lockdown and an outbreak that has come to us from outside. So yes, this is not the best use of my time, and I think it's probably best if most of these questions were directed to the Prime Minister. Yes, I understand the frustration. I appreciate that it was not a particularly good look. But again, I make the point, I'm not the Prime Minister's political advisor, I'm not his keeper. I don't make decisions on his travel. He is ultimately accountable to the Australian community for those decisions. But what we do need to do is ensure that our democracy can continue to function, and that we do need to have in place a regime that does allow federal parliament and federal parliamentarians to undertake their essential activities in Canberra. This is the nation's capital, it is the heart of Australian democracy, and so it does need to be able to function. But situations like this, I understand, cause concern, and it's not really a particularly good look. But there you go, I've just offered some political advice. I'm not sure whether the Prime Minister will listen to it or not.
It's been described as Hawaii 2.0.
Well, look, I could see why people would reach that conclusion.
Chief Minister, are you able to confirm if a positive case has visited the RG Casey DFAT building?
I'll need to take that one on notice. We'll be able to confirm that, I hope, and then provide that advice.
What implications does this continuing introduction of COVID into Canberra have for the length of our lockdown?
Well, we've had multiple incursions from New South Wales, and we're going to continue to face incursions from New South Wales. I think that's a fact. I've spoken at length about this over the last 25 days, that we're going to continue to face ongoing risk, not only of internal community transmission within the ACT, but new sparks emerging and new clusters emerging from a degree of cross-border travel. And we've seen some examples of that already. It all points to a very challenging next few months as we try and vaccinate the hundreds of thousands of people who remain unvaccinated. Well, we would love to have been able to do that more quickly, but for understandable reasons, certain Pfizer supplies in particular were prioritised into Sydney and New South Wales. Now, I made the point yesterday that we also need New South Wales to be vaccinated. I'm not opposed to New South Wales having nation-leading vaccination rate. That's a great thing, because that also protects the jurisdiction that sits wholly within New South Wales. But you would expect them to be with the highest first dose in the nation, given how much vaccine has been directed into that jurisdiction. What we will start to see over the next 4 to 6 weeks is the rebalancing of the national vaccination supply pipeline into the other states and territories. So I would say what has been very disappointing and frustrating is some of the national commentary criticising Queensland and WA and Victoria and South Australia, for example, for not having vaccination rates as high as New South Wales. That's because they weren't given as many vaccines. So let's be frank and honest about that. What I am proud of, though, is how well the ACT has fared in terms of our first and fully vaccinated, against a backdrop of not having the same level of vaccination supply. So what that points to is a much higher take-up of vaccination in the ACT, even within the supply constraints that we've seen. But that's important for our community, because we need it not only to protect ourselves and to bend our curve down, but also to provide a layer of protection from, from constant incursion of the virus from New South Wales.
Chief Minister Stephen Smith flagged this morning that discussions are ongoing regarding potentially relaxing restrictions at the end of this lockdown, so from the 17th of September. Can you provide any further clarity about what you'd be expecting to see with the outbreak, whether that's active cases, whether it's vaccination rates for this to happen?
Well, we've got 3 tools at our disposal. Vaccination rates that continue to increase, test, trace, isolate and quarantine that we're seeing working quite well, but it's not 100%. As you see from today's figures, we've got more than half fully isolated in their infectious period, but we've still got cases infectious in the community. So we can rely on that, but it's not 100%. And our third tool in the toolkit are our public health social measures. So we're going to only be able to gently ease them over the coming months until we get our vaccination rate up higher. So we're going to need to rely on those 3 tools to bend our curve and to keep cases as low as possible. So I think I've said this at least half a dozen times. We're not going to go from where we are now to no restrictions at all. It will be a gentle step as we get closer to 70 and then 80% fully vaccinated. Noting, as a point I've made about 20 times now, that it takes 2 weeks for the vaccine to be effective as a protection. So even once we pass the nominal 70 and 80%, we've got to wait 2 more weeks beyond that. So that's why I've been saying that it's going to be a difficult spring. It's going to take a while before our vaccination rates get to the level that we are in a position to be able to ease off in a significant way public health social measures. I mean, there's still hundreds of thousands of people who had no vaccination at all, and still well over 250,000 who are not fully vaccinated at the moment.
So can you confirm, though, whether there's anything we'd specifically need to be looking for by the 17th of September for anything to change? Or if we continue to see cases active in the community, will no further restrictions be eased?
Well, it's a little early to make that final observation, but the point I've made again repeatedly is that what we are looking at is cases active in the community, effective reproduction rates of the virus, what the transmission potential would be if we were to significantly or even moderately ease the measures. So there's no point easing to just see an explosion of cases to then have to put restrictions back in. So the preferred public policy path is gradual easing, not having to reverse decisions and go back on where we are. And so that philosophy is going to guide our decision making. So it's not yo-yoing in and out of really hard lockdown into no restrictions at all and back into a really hard lockdown and then no restrictions at all. We're not going to put the community through that, day by day, week by week over the next 2 months. What people should expect is a gradual easing of restrictions. That can happen sooner and the easing could be greater if the case numbers and the numbers infectious in the community, the effective reproduction rate are all lower.
I have questions for the Chief Health Officer later about Mr Morrison's trip, but while we have you, Mr Barr, could I please ask, are you concerned by reports that New South Wales is going to allow vaccinated residents back to pubs and clubs by mid-October? Are we on a similar timeline here in the ACT that enough people will have had a chance to be vaccinated to have rules like that? Or is that a disaster in the making where you can go to a pub in Queanbeyan but not Canberra?
Sure. It seems ambitious. It's still 5 or 6 weeks away. So you want to understand the circumstances, caseload, effective reproduction rate, where the vaccine efficacy was at that point. Difficult to project whether New South Wales are going to start sort of tapering their rate of vaccination growth just because they've got the most eager people that are already vaccinated and their sort of share of the vaccine supply will start to reduce. as a result of the rebalancing that I spoke about earlier. So I think that date, that mid-October date, is sort of based on a projection of where they think they'll be on double dose, 70%, I understand. So I wouldn't presume that because New South Wales might do something that's adventurous and risky that we would copy them. That's generally not been our approach. But if there's a noticeable reduction in cases, there's a noticeable reduction in virus spread, and it would be safe to do so in 6 to 7 weeks' time, then we'll look at it then. But right now, playing rule in or rule out games on things that might happen in 6 or 7 weeks, given a lot can change in 6 or 7 days, just seems a little bit foolish.
Chief Minister, is the ACT developing a vaccine passport like New South Wales, and if so, when might we see that?
Well, no, the vaccination status is a Commonwealth process that's available for people, I think either on your Medicare card or through MyGov or Services Australia. They'll have a way that you can prove your vaccination status. The question of whether that is linked to check-in apps is a separate question and reflects the different circumstances and nature of the check-in apps in the different states and territories. So as I understand the situation, New South Wales, Victoria and I believe South Australia have an identity verification app that they've been using as their check-in app that can effectively ping the Commonwealth system, and you've proved your identity in both, and therefore you can have your vax certificate on your state-based app. The ACT app, which is the best check-in app in the nation, built solely though for the purpose of checking in, is being used by Queensland, Tasmania, the Northern Territory and the ACT. But it is not an identity verification app. And so there's an open question about whether you can link a verified identity document to an app that you just put your name and mobile phone number in that doesn't verify identity. Then there is a philosophical question about whether you will have a set of arrangements that have certain privileges for people who are vaccinated and those who aren't, particularly in an environment where there would be people who have not yet been able to get vaccinated. So we've touched on this multiple times over the last 4 weeks as well, that we would be reluctant to put in place a regime that said only the vaccinated can do this if people haven't yet had the opportunity to get vaccinated. That's not particularly fair. And at no point would we deny access to essential services to anyone who was unvaccinated. I need to make that point as well.
Minister, you've clearly gone to lengths today to encourage pregnant women to get vaccinated, but there are long wait times. So we've had reports of women who booked in August, they couldn't get in until October. Is the government considering making them a priority at all when they do call to book in?
So there is a line, obviously, that does allow for people in those circumstances who are pregnant to access vaccination. This delay in being able to vaccinate everyone is a frustration. It's perhaps one of the many reasons people are frustrated with the Prime Minister, aside from today's frustration. We will get more, we are told we will get more Pfizer supplies as a result of both the Singapore and UK swaps, and that we will get more Pfizer supplies as a result of the rebalancing of the national program to reflect the fact that New South Wales got all those extra supplies. We also know that Moderna is coming and will be accessible through pharmacies, and we hope later this month. Plus, we've shortened the time period for the second dose of AstraZeneca. So the combination of those three factors, more mRNA vaccines, Pfizer and Moderna, and a shortened timeframe on AstraZeneca ought to enable the vaccination program to speed up. The question of how much quicker, I think if you just quickly do the maths, it's certainly going to be many weeks quicker, but I don't think it's going to be many months quicker.
Chief Minister, a couple of questions, if you don't mind. How many people are in quarantine or isolation, I'm not sure which is the correct term, who have the virus at the moment in the ACT, in community and social housing? And then a second one to that, what enforcement measures is the ACT government and ACT policing putting in place to make sure these people are actually staying at home and doing the right thing?
So quarantining with the virus. Okay.
Not in hospital.
Today or over the course of the outbreak?
Today.
I'll need to get that number updated. I mean, we've had 400 cases, a little over 400 cases in total. So a very small proportion of those would be people in social housing settings. So, but I don't have the exact number off the top of my head, but we can get that. We may be able to answer that one before the press conference is finished. And sorry, the second part.
Compliance. What compliance measures are in place? I mean, I've been told that people in places like Ainslie Village, Condamine Court, some of them are not actually doing the right thing. They're going out, they're not wearing masks, and we are seeing spread in those communities at the moment.
Yes, so there are a range of, well, there were certainly in relation to Condamine Court that people were released from quarantine there over the weekend. So a combination of public health, ACT policing, non-government community sector service providers on site. Strong engagement with individuals, particularly focusing on those who have a range of complex needs, including mental health issues as well. So it has been a person-centred wraparound service, multi-agency and non-government agency provider partners. A number of these sites are community housing, and so the on-site services are delivered by NGOs. We have faced the circumstance where almost the entire NGO staff have had to be furloughed or in quarantine themselves because of exposure risks. So this is a complex and challenging group to be working with in the middle of an outbreak. It reflects some very complex personal circumstances. Now, compliance across the general community isn't 100% either, so let's not place an unrealistic expectation on one group of the community over others. There have been in every city, in every context, some people for a variety of reasons, generally not fully understanding, but sometimes willfully doing the wrong thing. We've seen that everywhere, and Canberra's no different.
I guess my particular interest is that, you know, in Melbourne last year, for example, in the Flemington towers, which are very high density, we saw rapid spread. Now, the density here in those sorts of places in Canberra is not the same,
no.
But it is still higher density than a lot of parts of Canberra, and that is conducive to further spread. I mean, I guess I'm asking about perhaps increased compliance, because the alternative is, at a minimum, we sort of bump along with 10 or 20 cases for weeks to come. Yeah,
I wouldn't be attributing our case numbers to this particular cohort. That's not the major contributor. We're seeing a diversity of different settings, and that's included everything from, from workplaces, childcare centres, schools, sports facilities, nightclubs. There's been bars, there's been quite a range, so I don't think it's fair to categorise the ACT situation as being solely due to any one cohort. It's a wide mix, and that point I think is important. Dr. Coleman has gone to great lengths to explain the detail of where transmission's occurring. Most of our cases are household close contacts. The point I've made ad nauseum at these press conferences, that if you get infected, the people you are most likely to infect are the people closest to you. The next most likely people you're going to infect are the people you work closely with.
Chief Minister, the ACT government total revenue was higher than expected in the last financial year. The deficit was lower than expected. Will those gains be lost entirely as a result of this lockdown, do you think? Or is there a chance the economy will recover enough once restrictions are eased?
Difficult to tell this early in the financial year. The experience last year was that at the beginning of the last fiscal year, we were just coming out of the first lockdown, and then we had various bumps along the way with lockdowns in Sydney and impacts in, or at least in parts of Sydney, and impacts from Victoria. So what are we, 2 months into the fiscal year? We are certainly, yes, revenue is down at this point and expenditure would be up, but we will have the second half of the fiscal year to make it up. But it is very clear that the more COVID-free your economy is, the bigger it will be and the more taxation revenue it will generate.
Sorry, Chief Minister, one more. Sorry, the Prime Minister's on Sky News at the moment. He's accused, essentially, people of spreading misinformation about his trip to Sydney, said it's been misunderstood. His family didn't seek an exemption. He lives in Sydney and he simply returned home. Now, he's obviously been here 7 weeks. What's your response to that? Is this misinformation?
Well, I'm not sure who is being accused of spreading misinformation here. But I don't think it's anything I've said or anything the ACT government has said, but I think probably every politician in the history of time has had reason to feel that there's been misinformation spread about them in the media. That's life, I guess. Okay, thank you. Dr Coleman has about 5 minutes for questions before she needs to be at AHPPC. Thank you.
Good morning again, or afternoon.
Morning. Dr Coleman, can you just explain why you granted the PM an exemption, and did you feel any pressure to do so?
Look, I don't comment on individual cases. What I can say to you is that my job as the Chief Health Officer is to protect the ACT community. As part of that, we've put an exemptions process in place for essential work and activities, and this has been considered in line with those and granted in line with those.
Was it a mistake? Do you think it was a bad look? The Chief has just said it was a bad look for the Prime Minister to apply for the exemption. How do you feel about being?
So I don't have individuals' opinions on these things. I base on public health fact, public health assessment, and make a decision based on our current processes. And we have followed those processes at this point in time.
Could I ask, if you won't comment on specific cases, what are the specific grounds that a federal parliamentarian would need to satisfy the criteria they would need to satisfy to get an exemption? And picking up on the Chief Minister saying that you essentially had to take it on trust from the Commonwealth about the Prime Minister's purposes for being in Canberra, is there really no ability to look behind the reason that's provided to ask for more information about why a national security meeting that could be conducted by a phone hookup was necessary to be conducted in Canberra?
So first of all, there's very clear information on the website that everyone has access to about what constitutes essential work and essential travel. So I recommend that you actually look that up and you can find the answers to some of your questions there. Secondly, it's not up to the Chief Health Officer to make an assessment on the essentiality of businesses in areas that I have no understanding of. We work with different industries to understand their needs, and that is where I think the take on their information and understanding that we need to understand and respect that different industries put forward where they need essential work to occur. In the vast majority of cases, this has worked extremely well and will continue to do so. I'll just remind everyone that I do need to go to AHPPC, so if there's any specific COVID-related questions, now might be a good time.
Sorry, Doctor, you just said you didn't understand what was essential about the Prime Minister coming back to Canberra to do his job, but you approved his application.
I actually don't believe that's what I said. I said it's not a health officer position to be able to understand the essentiality of all different industry and their need to be conducting business in the ACT. That is why we have a conversation with different industries and we understand and put the onus on them to identify what is essential activity under certain businesses. In many ways, it is a trust relationship, as is much of society moving forward.
Chief, can you confirm how many genomic links have been detected in Canberra and when they were introduced?
Oh goodness, so you asking me, what do you mean by genomic links? Sorry,
I guess how many of, because there's over 40 something now that are unlinked, so those ones that are linked, how many different genomic links are there?
Yeah, I don't have that exact information with me today, but if you're asking me if it's about how many introductions into the ACT, different introductions we may have, we're still looking at around 5 or 6, and they will continue We do have exemptions under which people do travel, as we've just been discussing, and there are certain testing conditions to make sure that we can identify people who do have COVID as they come in. So some of those new introductions have been part of those essential travellers who have been tested positive for COVID, but because they are abiding by those conditions of being in quarantine except for their work, we have been onto that very quickly and have had no further spread from those instances.
Doctor, just following up on Paul's question, and I know you don't comment on individual cases, but in a theoretical future in which an MP who may or may not be the Prime Minister applies for an exemption to come into the ACT once again, is it possible that you might ask whether that person can dial in remotely next time?
We've been having ongoing conversations, myself and Paul Kelly and our officers, around making as Parliament House and other activities as safe as possible. This is the result, and we continue to work through that, and I don't think there's been any proof that it's been unsafe.
Just lastly on this one, so is there a bit of picking and choosing going on here? Because a few weeks ago, Barnaby Joyce wasn't able to come here because he was in a lockdown Armidale. He's the Deputy Prime Minister. And then he was granted an exemption to come here this time for a sitting week. Why? What's the difference? I mean, obviously his job is the same. It hasn't changed. So why was he unable to come for one sitting week but is able to come now? Does it seem to you that these ministers are picking and choosing when they are coming here or not?
I treat every travel exemption application on its merits. We have an overarching process which we put in place and we understand and we interrogate. However, each one is assessed on a case-by-case basis. And once again, I won't be commenting on individual circumstances. Thank you.